All right, good evening, everyone. Thank you guys for joining tonight. Just wait a couple more minutes for a few more people to join and for Corey to jump on as well. As per usual, guys, any questions, feel free to write them in the chat or the Q&A box, and we will get to those at the end of the webinar.
Hey, Leanne.
Hey, Corey.
How you doing?
Not too bad. How are you?
I'm doing well. Doing well. Thanks a lot for rescheduling. Oh, sorry, my video's off.
Yeah, I was just gonna say, I can't see you.
I know what's going on here. It helps when it's plugged in, usually. There we go. All right. Now we should be able to go. Perfect.
Awesome. Are you at the office?
I am, yeah.
Nice.
Yeah. Just this call and then I'll be heading home.
Nice.
Yeah.
Hopefully it'll still be, I don't know what time the sun sets, but
It's
hopefully it'll get some sun.
it's like 8-4. Depends on like how high up you are on a hill or whatnot. But
Right.
have you been hitting sunrise and sunset? Nice. How do you feel?
Better. Yeah.
Yeah.
I've been using that circadian app that kind of tells you sunrise, sunset, and then UV, UVA, UVB, and all that jazz. So
nice.
Yeah, I love it.
Yeah, that's great. Yeah, keep stick to it. It's slow and sometimes slower than you're expecting, but just keep sticking with it, and it's pretty transformative.
Yeah, I know. I just need to get better at staying out a little longer.
Yeah.
I'm impatient.
The other trick too is when it gets into summer, get up early and watch the sunrise, but don't deprive yourself of sleep trying to get the sunset. Right. Yeah. Go to bed at 6, 7, 8 p.m. if you need to. Just that's the main thing. Don't deprive yourself of just to try to get sunset. Yeah. Awesome. All right. Okay. So thanks everyone for joining this evening for tonight's webinar, all about neurofeedback and brain mapping, kind of supporting chronic conditions. Tonight, we have the privilege of speaking with Corey. He is a certified functional medicine practitioner, among many other things, and works at Nevada Health Clinic. So what exactly is neurofeedback and brain mapping? It seems a little foreign to me. I'm not super familiar with it, and I'm sure a lot of people are very curious about it and not too sure what it is either. Yeah. So neurofeedback is processes developed in the 70s. Originally, actually, it was found through research on cats, where they found that they could, as unethical as this is, poison cats and see what brain damage happened. And basically they could poison cats into getting seizures. So they then took this neurofeedback technique and were seeing if they could train seizures out of the cats, and they could. So even though they had been, they had toxin that damaged their brain, the brain could be trained to actually regain function again. And we've known this through the principles of neuroplasticity. So it works to guide the brain into a new neuroplastic state. So I can explain a little more in depth, and I have some diagrams down as we get into the interview if you'd like.
Yeah.
But yeah, so that's kind of what neurofeedback's doing. And we have the ability to do what's called like EEG guided. So what that means is we're picking an electrical signal up that's coming off of the brain. And then we're isolating it, we're analyzing it, we're calculating it. And then we are feeding back information to the brain through audio and video, auditory and visual. And that allows the brain to kind of engage in something. And then when that happens, the feedback, whether the person's getting feedback or not, determines how the brain's then going to shift itself. And so there's all these kind of underlying neural mechanisms that drive that, but basically it allows us to teach the brain into a new state of operation. So if people are feeling like really, anxious or dizzy or low mood or cognitive problems, we can target the areas in the brain or the networks in the brain that it's constantly shifting in and out of, and we can train them so they're working more optimally for whatever's kind of causing these underlying brain problems. QEEG, quantitative EEG, is the imaging technique that we use to look at the functionality of the brain. So maybe I'll just share my screen so I can sometimes break it down a little better if I show a visual. Can you see that okay?
Yeah.
Okay. So basically what we do is we strap a helmet that looks kind of like this. We also use a different cap that actually has almost looks like a shower cap as well. That gives us more of a clinical connection. But we strap that on and then we start collecting data that looks a little bit like this. So each line is a different spot on the head. And we're just basically picking up all this electrical noise, right? And if somebody doesn't have seizure activity or epileptic activity, or unless you're really well trained to look at the raw data here, you don't see a whole lot. It doesn't really tell you a lot.
Mm-hmm.
But what you can do is you can run that through databases where your brain is compared to somebody who is the same age and the same handedness and gender. And then it tells you kind of how far out away from the average you are in various different frequencies, various different regions of the brain, and then communication, how well or not well the brain's communicating. So ideally, when we look at these maps, we want to see something a little closer to this. Yeah, I don't know if you want to call that gray. And when we see it go more blue, what that means is there's low expression or low power of that frequency. And when it's elevated, so it's more orange or red, there's too much of that particular frequency. And then the bottom kind of just tells you whether the brain's hyper or hypo communicating. So where it's not communicating enough, or it's communicating too much, or if it's sending signals too fast or not fast enough, or if the volume is off. So the brain regions talk to each other a lot like we do, where we use tone and volume and facial expressions to communicate. That's kind of what the brain has, a few different dimensions that it communicates in like that. So that then allows us to look at what's affecting the brain. So when I first started doing this, is really interesting because I would look at these maps and, it would just kind of tell me the different frequencies. But over the years with enough data, biomedical data, we've started actually being able to use this as a predictive algorithm for underlying causes within disease states as well. So if people are having symptoms, this is like the first piece that helps us determine what it might be. Because with regards to the brain, the brain's getting insulted all the time by various different things, right? Stressors, toxins, mental or emotional stress, trauma, head trauma, all these things, and even just our lifestyle as well can affect and kind of change the brain. So we want to always know, okay, where's the main meat of the potato where we need to be looking, so we know that we're not just looking down a whole bunch of rabbit holes that aren't actually going to lead anywhere. So allows us to assess the circadian rhythm. It allows us to see areas a little deeper down in the brain, all the way down to the cerebellum. So that's like what I'm showing you here. And then we get a little bit better measure of communication and how it's going through the brain. We can visualize it a little better. So we can, for the most part, figure out kind of exactly why people are having the symptoms they're having. And then, treat them accordingly. It's almost like a way that we can triage.
So I'm just thinking of, let's say someone's exposed to like aluminum, you know, they have a lot of stored in their tissue in their brain or something. Is that something you guys can figure out?
Yeah, it's not that specific.
Okay.
But when you're looking at a specific frequency band called delta and another one called gamma, happens to be the lowest frequency in the brain and the highest that we can measure. If you look at those, they can be a surrogate marker into inflammation. And depending on the causative factor of inflammation, you'll see it show up a little differently. So like heavy metal exposure tends to slow the brain waves, so there'll be a lot more delta.
Okay.
My brain there was actually low delta, which is a sign of another problem, which is a metabolic problem or a mitochondria related issue typically. But the mitochondrial issue is creating an innate immune response, and that's why you're seeing it show up in delta. So it looks inflammatory, but it's usually more self-induced inflammation, excluding autoimmunity. And then autoimmune reactions show up a little different as well, where delta band goes high and alpha band goes low. And then when we look deeper, like the diagram I was showing here, when we look at deeper areas down in the brain, we can actually tell if there might be a structural problem. We don't know for sure, but it gives us some indication as to whether an MRI might be appropriate. So like in my case, you'll see this really low delta across the frontal strip. That can be indicative of really, really low grade, what we call atrophy in areas in the basal ganglia, which is just an area that regulates and idles and transitions brainwave information. It's involved in motor movement as well as our attention processes. So you can get all sorts of different symptoms. So when we look at the brain, that's kind of one thing we also use the QEEG for, which is why I'm glad you brought it up, is to see if there might actually be structural components that are a problem. And it's a lot more prevalent than people think, because most of these are microstructure changes. So when a radiologist looks at it, it's going to look normal. That's really good news. You don't have any lesions, you don't have any tumors, anything like that. But there can still be structural problems, but you need a computer to analyze it. So you can get a special QEEG called a neuroquant. So that's the other thing that kind of guides us to is, do we need to look structurally? Because treating a problem that's functional is a lot different than treating a problem that's structural. So.
Yeah, like I'm just thinking, even with autoimmune disease, because usually the approach is for treating that or for addressing that is quite different. And so are you saying from this angle, you're kind of retraining the brain to kind of communicate to the rest of the body to kind of come back into balance? Is that kind of the approach?
Yeah, exactly. This is kind of a yes and no question, because what you're doing is when you analyze these brain maps, what you're actually seeing is how the nervous system holds stress patterns. And there's a different frequency and wavelength in basically the way that, because stress essentially everything in us is light, because mitochondria store light, right? They receive photons of light, and then all of our electrical impulses are all just light, right? So what you're seeing is how the light patterns being refracted through the nervous system. When we can flow it includes the enteric nervous system, the heart, right? That entire peripheral and central nervous system. When you're changing anything, for one, when you're assessing the brain, it tells you that refraction pattern, and then when you're addressing it, you can kind of see a better idea of what's going on, and then it will actually not just kind of fix the brain, but also balances out the entire nervous system. So there's a very intimate connection between the heart and the brain, for instance, which we know a lot better now. And so a lot of times it's not that you're necessarily fixing the brain, it's that you're fixing neurophysiology, right? You're fixing the nervous system state so that the body can heal, because the body knows how to heal. Right. We still there's this idea that the brain couldn't for a really long time. And we still isolate neuronal stem cells in the medial temporal regions of the brain in well into our 80s. So it's really just kind of like getting stuff out of the way so that light can flow coherently between the brain and the heart. And when that happens, you heal. So it's really just helps us kind of dig in. And then with neurofeedback's just kind of one tool, in our toolbox, where we don't use it all the time, because neurofeedback in more of a inflammatory problem or certain circadian rhythm problems, which are incredibly prevalent. I think we talked about that last time. When you're having those sorts of issues, you don't use neurofeedback. But if you have post-concussion problems or you have trauma, that's where you can really, really approach it well with neurofeedback. So that's kind of a breakdown of that.
That's awesome. Yeah, I was just going to ask, like, what other, so you said concussion, something like PTSD or anxiety, depression, things like that. Is that common?
ADD, ADHD, it has a lot of literature. Autism and ODD have a lot of literature. OCD, as you mentioned, post-concussion, pretty much any cognitive impairment, headache issues, migraines, not as efficacious as the aforementioned ones, but it is effective. And then tinnitus and ringing in the ears, again, a little lower effectiveness, but still effective. In some of those cases, we actually couple it with what's called transcranial laser therapy, which is really cool. Again, back to the light conversation, is we're using infrared and red light, kind of pulsed at a focus point. So the helmet we have has 320 lasers or lights. And then that actually penetrates down. And I'm very visual, so I'd love to just show this.
I appreciate that. Yeah. So is that something more? Because I know sometimes with tinnitus, it can be a structural, like if there was a trauma, or it can be just like hearing loss. So does it kind of target both of those?
It depends on the cause. There's 5 different causes of tinnitus. There's 5 different types of tinnitus or tinnitus. There is a structural component. So, ear damage, right? That, no, not overly effective. There's another one called a malocclusion, where the jaw, when we bite, the jaw actually occludes up and pushes into the ear canal. And sometimes people don't even really notice because they're all the time, but that can create the tinnitus sensation. And a way you can tell if you have that type is if you put your pinky fingers in your ears and then open your jaw and close. And if you can feel your ear canals tighten a lot or it like pops, then you know that you have a malocclusion. And that, again, same thing, neurofeedback, not incredibly helpful for that. Because usually that's a structural upper cervical problem or an actual dental occlusion of some sort. Right. If it's a muscle tension pattern that's pulling somebody into that state, then neurofeedback's helpful, because usually we tense when we're tightening and protecting. And that's a lot of times that actually goes back to trauma, and that's where a lot of chronic pain stuff is too, which is why it can be effective for pain disorders and stuff like that too. So
awesome. Sorry, I kind of jumped in. What were you going to show?
Right, sorry. Getting hyper focused. I just wanted to show a diagram. Actually, I think I had a screenshot of it. Dr. Courtney Hunt printed. She's very good if you want to follow somebody on Instagram that is sharing a lot of great knowledge right now. She does a early morning Instagram, sunrise Instagram, like talk session, answers questions, and she's very very knowledgeable in biophysics. So basically how physics like light and magnetism and stuff like that affect our body. But you'll see that the kind of the rainbow of the light here, red and infrared light have the longest wavelength, so they penetrate the deepest through the skin. Most people are deficient in red and infrared because we live indoors most of us most of the time, right? We don't spend a lot of time outside.
Yeah.
So yeah, what this laser does, it just kind of focuses it, and it'll actually penetrate all the way down to some of these areas I was showing you, like the thalamus, all the gray matter. And we use this as a protocol to actually help with cortical atrophy and enlargement, like we're seeing here. It's being used for neurodegeneration right now, Alzheimer's, Parkinson's. The data is very impressive, and that's just a standalone therapy. So yeah, that's kind of why that works, how that works. But it reduces inflammation, and then it drives mitochondria function up, so we have enough energy to build new synapses and actually rebuild some of the structural problems that occur.
Fascinating.
Yeah.
So with this type of treatment, is it typically, 1 or 2 sessions? Is there kind of other things that go along with it? Like, how does that look for someone who's interested in maybe starting that treatment?
Yeah, so neurofeedback, ideally, you want to be getting in for at least twice a week to start. And you do that. We always do about a 8 session, kind of 1 month, 8 sessions. So 2 per week, they're 1 hour long. And then once we do 8, we remap and we make sure that we're kind of dealing, and we're actually succeeding at dealing with the pattern that we're working with. We can kind of tell that just from the EEG data as people are doing their sessions, but we get kind of a clinical reassessment, and we see where people are at that point. Depending on what people are dealing with, and the nature of their condition, you're usually looking at minimum 10 to 15 sessions. And then in the literature, if you're dealing with like a severe ADHD case or whatnot, they sometimes say like up to 80. Most people we see don't need to do that much. A lot of that is because when they do research, they isolate therapies, right? So you're only doing neurofeedback.
Right.
Whereas for us, we're looking at, okay, how did your brain get here? Because if we don't address that, all we're doing is treating symptoms with neurofeedback, right? If anything, we're hoping we can shift the brain. But a lot of times, if there's something created that state and we don't take care of it,
right,
stop treatment, what's going to happen, right?
Yeah.
So yeah, so usually I would say average that people see us for would be about 24 sessions. Some people more, some people that have severe seizure disorders, they need to do it almost weekly just to kind of keep things at bay.
Right.
And sometimes we can't fix absolutely everything, or we can't at least, get it to the point where it's 100%, but it really helps people manage conditions like that. So
yeah, even someone who has chronic pain, and I feel like that's quite common, whether it's like an old injury that's healed and it's kind of stuck around. Would you use that in conjunction with certain medications? Or are you kind of focusing on maybe let's start with the brain mapping and neurofeedback and then kind of go from there?
Yeah, it totally individual by individual basis. If somebody has a multitude of problems, and I know that we're going to need to, like a metabolic problem is the biggest issue. When mitochondria aren't functioning for whatever reason, they're not functioning properly, and you're trying to change the brain, it can take a lot longer, right? And it can be a slower process. And then there's more side effects to it too, because with neurofeedback, you do get like low-grade headaches, low-grade fatigue, sometimes a little bit of your sleep gets thrown off a little bit because your circadian rhythm's getting shifted. But they're transient. They never last longer than about a day.
Okay.
So you kind of got to be mindful of that. If you're going to be doing just one therapy, is making sure, okay, is there anything that might be holding me back here? Neurofeedback's paid out of pocket, so you don't want to be giving people therapy that's not going to be fully effective, or that's not going to be effective at all. So
right.
It kind of depends, but we do have some people like that we see with trauma and head injury where they don't have a lot of other stuff going on. It's pretty isolated. Then we would just be doing neurofeedback or maybe some trauma processing work with them.
What about ARDR? Like, is that what you would combine of listening to music or whatever, wherever, sorry, whatever else you have them listening to?
Yeah, exactly. So what we always get a foundation with neurofeedback first, because for a brain, well, even like, my brain that I was showing you a minute ago, the cerebellum, in my case, I don't have a lot of problems back there. I used to, but if you have a lot of poor communication back here, and you try to do anything that's related to trauma processing, it actually will slow the process, and in some cases, it makes it worse, because people actually, because of their brain is functioning's been thrown off, and sometimes for a long time, like by the time people realize that they have trauma, it can be decades, right? So you don't want to go, okay, let's go process your trauma when certain areas aren't functioning properly, or now you just unloaded a bunch of trauma on a brain that does not have the resources to cope with it, let alone integrate it and process it. So that's always my caution with jumping straight to bilateral stimulation, either auditory or visual. The reality is most people handle it okay, but you want to make sure that you're making the proper decisions for your health. So this is just a good publication that shows this. When there's metabolic connectivity in the cerebellum, like those lines I was showing you, it looks a lot severe in other people, but EMDR was less efficient. So yeah, the reason why is the cerebellum actually works to time and relay and orchestrate all the signals that are going through the brain. So if you can't, when you're going to do something as deep as like processing trauma and working through that, and you're not timing things properly as you get sensations, and then you interpret those and process and integrate them and hold space, then you're just going to flare people. So we always do that first, and then we move them into kind of various other trauma therapies, and either referred out or what we can do here.
Yes.
Yeah, there are neurofeedback protocols that can specifically target frequencies that do trauma processing, but we like to do it with through somebody that is qualified to be able to actually work them through what can come up. So
yeah, I was just gonna say, I feel like it's really important to find someone that has the training. Just I'm sure it's becoming a lot more popular. And is there just like one kind of school that has all of this like training, or is it kind of all around?
No, this is this was actually my frustration for a really long time, that this wasn't integrated into almost anything you take. So I had to take some of like my medical science knowledge and integrate it with natural medicine knowledge, and integrate it with neuroscience knowledge, and then integrate it with anti-aging, and then integrate that with functional medicine. And we have a pretty good process here that I think can really help get to the bottom of things for people quickly. So we are putting it into a course. We're gonna have that ready in about July or August. But
oh wow.
Yeah. So I'll definitely keep you posted with a link. But and people can send us an email if they're interested in that. They want to get an email when it's ready, sort of thing. Yeah, so unfortunately, no, it's a lot of different fields of knowledge all integrated together, which in my opinion is the future of medicine. So
yeah, absolutely.
Yeah.
And so just going back to a bit, on average it's 24 kind of sessions, and then once they're done, what does that look like kind of post treatment for people?
Good question. So yeah, some people we get to that kind of end point, and usually what we'll do is over time we do a bit more neurofeedback at first, and then we spread them out more and more and more and more as time goes on, because the brain gets good at being in that state, right? It's like riding a bike, right? You're doing it all the time at first until you learn, and then you can come back 10-20 years later, and then you're right back on the wagon again. So we will usually spread that out until we know for sure that things are good and there's no backslide, and we just say, okay, let's take a month off, 2 months off, 3 months off, and just pay attention, right? If you're starting to notice stuff come up that you're not able to work through, then we or you hit your head, or whatever else, or you get COVID. That's the new one, post-COVID. And then we come in and we do another map. We just kind of see where we're at. Some people finish and we never see them again. So everyone's a little bit different. So
yeah. Speaking of that, like of post-COVID, like long haulers, has there been any, I know it's obviously fairly new, but is this something that might kind of help with that, or is it still kind of unknown at this point?
There's lots of different therapies that help. What I kind of say about COVID is twofolded. One, our mitochondria as a civilization has never been more unhealthy. And mitochondria are the organelles that make energy. They also downregulate inflammation. They allow us to detox through autophagy. They do everything for us. We've never had a population of more sick mitochondria. So the natural vaccine to viruses and toxin and everything like that's like worn out in our body, right? So that's the first problem with COVID. And so because of that, COVID is the straw that breaks the camel's back, so to speak, right? That it was the breaking point. And we made a lot of knee-jerk reactions out of fear in the beginning, and we locked everyone in their houses, and people weren't going outside and they weren't exercising. The biggest problem is they weren't going outside, and their mitochondria got sicker and sicker and sicker. And that's now that we know, we've known all this for a long time, but they're just too many knee-jerk reactions at the beginning, and now we're dealing with the brunt of it. So this is probably the biggest problem I've seen, like especially like mental health. I've never seen anything like it. Yeah. I haven't been around that long, but I've just seen how the patients that we have coming in, how that's changed. So anybody that's dealing with issues out there, just know you're not alone, and there's resources and people are there for you.
Yeah, definitely. Just from speaking to people and in the industry and friends and family, and it's like it's been such a whirlwind and a struggle for sure. I think you talking about that webinar we had, we were talking about light, and I kind of stumbled upon Dr. Jack Cruz. Like some of his stuff is like over my head, I'm not gonna lie, but
he's very scientific. He likes accuracy.
Yes. Just kind of going back to the basics of nature and getting outside and all. It's just so fascinating, and just kind of a completely different approach. We always focus on nutrition and everything else so much, but quite fascinating. So
it's funny how much like now we have like, I mean, essentially you can't even ignore it. You can't even pretend that there's not enough out there, because there's so much. It needs to be the foundation, like that's the foundation that exercise and diet and mental stress and everything like that go on top of. Because if you don't have light, your biology does not function in order for you to to respond properly to those higher levels, right? So you don't want to take a pyramid and take the foundation and shrink the volume of it and then go, we're going to pay attention to nutrition, because now you're teetering pyramid, right? And you just never know when that's going to go down. So it's really quite interesting.
Yeah, absolutely. If you guys are interested more in that conversation, just send me an email or a message in the chat here. I can send you that recording as well. Maybe we can get to some of the questions. I feel like there's quite a few.
That might drive some conversation.
So I'm just wondering if there's any kind of long-term studies on the success of this treatment. I'd be scared to do it if it hasn't been studied long-term.
Yeah. Yeah. So you can search, if you search longitudinal studies, neurofeedback, there's lots. Really, really safe therapy, like incredibly safe if you're doing it right. Because even if you did change the brain in a way that the brain couldn't integrate, you know exactly what you trained and what you did and what areas and connections. So you just train them back. So it's not long term, because all we're doing is guiding neuroplasticity. So we can always guide it a different direction as needed, which is why we have constant follow-up in the beginning to make sure, because the brain's going to let us know if it doesn't like it, right? It's going to say something in a symptom way or in the EEG, right? So we have predictive biomarkers to see that. So the trouble with the longitudinal studies, not so much on the safety, but the efficacy is a heck of a lot better when you are integrating it with therapies that make sense for what's going on. So most longitudinal studies are isolated, right? And it's just neurofeedback treatment. If they're not doing anything to actively change anything else, and so they're not working on anything that got them there, again, if it was trauma or head injuries, different story, but then the longitudinal efficacy does start to wear off. But that's why that happens, is if people don't learn about themselves and how to regulate, and they don't clean up what got them there, then they can trickle back. So
right. And then they were also asking if you had a picture of kind of before and after of your brain.
Totally, I can pull that up here. Oops. This is actually a pretty good example here. And I have one more to share as well. So this is a patient with trauma. And what you're seeing is a lot of activation in the amygdala on the left side here. So these are all deeper down brain regions. It's just a kind of an easier way for us to lay it out in 2 dimensions. This was after neurofeedback, completely regulated. She had an interesting activation here where Brodmann area 33 was elevated. So there's a lot of irritability, agitation, anger, anxiety, withdrawal, cognitive problems. And again, that cleaned up. But what we saw was this theta frequency elevated more on the surface. And so this is interesting because they did neurofeedback only to start. They didn't want to look at anything else. And we were able to clean the trauma stuff up because that's what neurofeedback's good for. But what happened was this isn't technically theta. This is slow alpha. She developed kind of a metabolic stressor, which tells us that something's affecting her metabolics and her brain's kind of getting tired as it's trying to change. Right. So we know that we need to kind of look into that next. So it's really quite cool because as you resolve, one pattern, if there's still some stuff left, you'll know what you need to do next. Right. So it's a great way to just objectively track.
Yeah. And kind of what is the cost then per session?
An hourly cost for neurofeedback is $130. And then the kind of initial consult, which is the whole neuroanalysis. So we look at a couple other markers, not just QEEG, but we'll look at the kind of full nervous system assessment, and then a 2-hour review with myself to kind of go through medical history, talk about anything that's going on, medications, and then we can make a decision on kind of how we move forward. That cost kind of varies depending on what people are dealing with. So yeah.
Perfect. so can neurofeedback and kind of brain mapping help people with Down syndrome or dermatitis?
So Down syndrome, yes. Mainly because with Down syndrome, there's a lot of times circuits that didn't develop right, and there's a lot of low-hanging fruit, meaning there's a lot of like little adjustments we can make that can make a big difference. It's especially helpful in cognition and in emotional regulation in Down syndrome. Yeah. And then, sorry, the other one was dermatitis.
Yeah.
Dermatitis pretty unlikely unless the main causative factor underlying it was trauma, like developmental emotional trauma that was destabilizing the immune system, which does happen, but it's less common.
Perfect. Does this kind of help with chronic migraine?
Yeah. There's 4 types of migraines in terms of like the types and kind of root causes. One is structural, which is usually a reduction in the putamen, a part of that basal ganglia that I was showing earlier. That one, you can get some improvements, but a lot of times you won't get resolution on its own, because you got to repair structure. So the other type is a inhibitory neurotransmitter problem. So it almost creates this they're almost like pseudo seizure states. My migraines are a lot more like a seizure than they are like a headache, by the way. They're a neurological phenomena. So there is like a thalamic component to that. Then there's an inflammatory and metabolic component as well. So if you're not getting enough energy resources, you can go your mitochondria, if they're in the cell danger response, anything like that, it can activate that state, and neurofeedback's not overly helpful. We have one modality that's fairly helpful, but it doesn't reverse it. So you have to go and kind of figure out what you're dealing with. And then there's trauma-based migraines. And again, neurofeedback's helpful for that. So it's always really important for people to understand that this can help a lot of things, but you need a solid assessment to make sure that it's even worth your while, right? Because if you don't know what the underlying reasons are for what you're dealing with, then it's easy to kind of like go and pick the therapy that you're gonna spend a bunch of time and money on and not get anywhere. So that's really important, is getting that initial assessment to determine that. The reality of any condition aside from your genetic disorders is it's not based on genetics. There's genetic susceptibilities, or like basically where your chain is weak and where it's going to break. The other reality is it's not as simple as going, I have migraines, therefore I'm deficient in this mineral. That's not how it works. I just want to actually show another chart here, because it's helpful to visualize, because this one took me a little while to figure out as a practitioner. And I was a patient before I was a practitioner, so I kind of know how it's like. But basically we have this stress tank, and this stress tank fills up with all these various types of stressors. The difficulty is, as soon as the stressors fill, it doesn't matter what they are. There's all sorts of variations and permutations of how much and what, and mineral imbalances and circadian rhythms and everything, right? All these added stresses. We got to figure out what the ones are that are filling the tank the most. Whatever's filling the tank, when the tank fills, it spills over. The nervous system cannot tell the difference between these different stressors. So it just basically chalks them up. It's either a 1 or a 0 for the most part, right? So we don't know when we're having anxiety that it's due to blood sugar or due to infection or due to toxin, right? We can do some trial and error stuff to try to dwindle it down, but we don't know, because the nervous system doesn't discern. So a nervous system turns on once that floods, and then that's where you start getting all these problems that lead to clinical conditions and lead to symptoms. And you could write basically any symptom and condition down here, and it's going to be because of this, or cellular aging and stuff like that. So The only thing that's, like I said, an exception is a chromosomal disorder, right? Like Down syndrome and stuff like that. But even those disorders can have a stress tank too full, and then they'll start having other problems on top of their genetic disorder conditions. So
right.
all of that can be improved.
Fascinating. What about then for teens or children, like kind of what's the age?
Yeah, I mean, there's research all the way down to about to age 4 to 6. The biggest problem with like kids are great because their brain is changing so quick. Like they're just unwiring. It's like they know everything and they're just like deciding what's important.
Mm-hmm.
Synaptic pruning, right? They're just very dialed in, and so that's the easy process. So if you can train the brain while it's doing that, it's way faster, way more sustainable improvements. They also haven't developed too many bad habits yet. So yeah, it's always a little better to deal with it earlier. And you just get more rapid change, and there's no problems doing that at all. So
yeah, that's good to know. I feel like a lot of kids probably just can't be on certain medications and things like that. This might be a better solution for a lot of things too.
Yeah, and the to add to the medication side of things too is what people need to understand about medications is that when you give a psychotropic medication, basically like antidepressant, anti-anxiety, stimulant, right, barbiturate, hypnotic for sleep, benzodiazepines, antipsychotics, right? These are a lot of the categories. Anti-seizure. Mm-hmm. When you give that chemical, all it does is increase or decrease the likelihood of the entire brain circuitry firing or not firing. So it doesn't get to be selective. It doesn't get to go, okay, we want to turn this area on, but not this one. Mm-hmm. Right. So medications are great to like get stability, but I really encourage people as soon as you can to start looking at this if you have had to go on medication, because the medication will not be effective forever if you don't address why you got there. You're going to end up with more meds typically to try to keep stability, and you start getting tolerance to a lot of them as well. So not only do your brain function gets kind of impaired for a really long period of time, but trying to come off of them can be more difficult the longer you're on them as well. So medications are fantastic and I mean utterly essential in a lot of cases to bring some stability, but you want to make sure you go and figure out what got you there, or you're going to be staring at it in the face in another 10 or 20 years typically. Right. There's some lucky people that it just works for them forever and they're good to go, but that's more of the outlier than it is the reality. So
awesome. So this is someone who's had brain surgery and they kind of lost their brain endurance and stamina. Okay. i.e. can no longer drive long distances. They were told by their brain specialists and neurosurgeons that once you lose your brain endurance and brain stamina, you can no longer get it back. Is there a way to improve that brain stamina?
Yeah, I've never heard that statement before. I'd be interested to get the specifics on that, but yeah, with head injury, it's tricky because it depends on how the head injury happened, what the extent of damage was, how long you've been in post-concussion syndrome for. A lot of times if you aren't recovering from concussion, it's because other underlying factors are preventing you from doing so. So those need to be addressed. One thing that it is really helpful for with concussion is getting the brain communicating better again. So a lot of times people will lose energy because the brain starts talking in inefficient ways after a head injury. We get shearing of white matter, which causes misfiring in the brain. It can sometimes take the brain a really long time to learn how to readapt, and sometimes it adapts these because the brain, frankly, as brilliant as it is, it's lazy. It will do the bare minimum in order to conserve energy. So it just kind of, once it settles, it doesn't always really know how to go back to where it was before on its own. So this is where functional neurology and neurofeedback come in. If you can get those and in head injury case with communication, I mean, it is almost 100% effective. Once you get that worked out, then usually your energy is going to be better because you're not burning as much having to manage, right? We create more efficient use of resources in the brain. So typically it does help with that. Whether it reverses it or not is tricky to say, because there are like growth hormone problems that happen, other neuropeptide problems. So you got to kind of keep those in mind, but it does help with getting your brain to use resources more efficiently, which is why it works for optimization too. People that aren't really having any problems, but they just want to focus on optimizing.
Right. Yeah. Perfect. Is there any peer-reviewed research you could pass along?
A lot. Anything specific?
Yeah. For this person, yeah, they didn't say anything. Maybe if there was just like a couple links that.
Yeah, I mean, if you just search, I could send a couple meta-analyses, but otherwise just search neurofeedback in Google Scholar or in PubMed, and
yeah,
you're gonna find about 40 years worth of reading.
Perfect. Do you give your patients kind of copy of their data and reports and kind of 3D brain scans?
Yeah, we sure do. Yeah, and then we can also write a kind of interpretation report if they request as well. What I always do with people is just, when they come in, if they want me to record, I can record my screen and our conversation while we go through everything, and then they can copy that on a USB so they can go back through it again. Because that's what I like to do. I like to kind of get all the information out, and then they can review that recording if they want, so they can, because it is a lot of info. So a lot of people, they have to take it away and kind of go, okay, break down these different components and research them a little more. And other people, it just feels right. And they're like, yeah, this resonates. And I don't really care too much about the report, but yeah, we do that for sure.
Awesome. I was pictured like Cerebro. Is that his name from X-Men?
Almost. That's what we used to call our one of our helmets that I was showing you there.
Yeah.
The other one was the sorting hat from Harry Potter.
Nice. Love that. So what is the, I think we touched on this briefly, but what is the neurofeedback method you use? Is it sound or specific type of meditation?
Auditory and visual, and we'll do meditations at the same time in some cases. Other cases you're watching a show or a movie. It's always something educational, so you can learn about your brain while working on your brain. We found it more effective. Which it's almost like that, like a lot of like the visualization research that you see, where if you can understand what's going on in your brain, for one, it's going to help you day to day. And for the other, it actually helps the brain train. We'll do music if we're doing sound only, or we're doing any eyes closed states, which eyes closed you'll do for like sleep problems and if there's any significant problems with trauma activation and eyes closed, stuff like that. And then we can do games as well. They're not like your fancy Call of Duty games or anything like that, but we can do some games as well. So it's really, you just have to be able to reward the brain. It's operant conditioning. So when the brain's shifting into the state we want it to shift in, you'll get feedback. When it's not, you won't, and it just slowly will reinforce that trained state.
Right. So what specifically does it do for tinnitus? Is it kind of buzzing into the ears, or does it cure tinnitus?
Yeah, so we don't do any buzzing into the ear work or any sound work. It's just a risky process with tinnitus because it's hard to predict what could flare it more. So we don't do anything like that. Basically, we isolate, if it's neurological, we isolate usually it involves an area called the insula that's in the medial temporal, kind of left and right side of the brain. It's the emotional sensation knob, or the how important is something knob. So how loud or how quiet a stimulus is mitigated by that. If it's not processing things effectively enough, you'll get reverberation, basically feedback back into the auditory cortex when that's not supposed to happen. That's not where most of the resources should flow. It should flow towards the insula, not away. So when the insula can't process enough information fast enough, it feeds back like a microphone and you get this ringing. And so it's actually more like, in those cases, it's more like ringing in the brain, not in the ear. Right. If it's structural in inner ear canal, neurofeedback's not helpful. If it's a malocclusion, as I talked about earlier, neurofeedback's not helpful because it's not getting to the reason why it's happening. But yeah, the other neurological episodes, it's usually the insula, or the insula is just far too activated. And that's causing the feedback mechanism. Tinnitus, I've seen a lot of tinnitus, is a trauma pattern, basically like a resistance to healing. It's like something's not integrating if it's a trauma scenario. Yeah.
Interesting.
And then other times people just get hit with a sound and it triggers it. But there are inflammatory subtypes to it. There are metabolic subtypes to it. So it's not as easy as, oh, this is tinnitus. Here's the protocol for everybody, and here's how long we do it, and it's a cure.
Yeah. I think
it can help. It can help a lot, but
right. Yeah. If it's something more structural, wouldn't like NUCA, so that specific upper cervical chiropractic care might help with that.
Exactly. That and structural dentists. Yeah. You want to do NUCA first to get everything straight. And a lot of times if it resolves, you're good. If NUCA has you straight and x-rays all look good, then you need to see a structural dentist to get a dental occlusion fixed. Sometimes need a bit of an appliance, but yeah, that's another one you want to get on right away. You don't want to let that drag on because it can cause a lot of TMJ problems. Yeah, absolutely. So I'm worried. I'd be worried about making my brain worse. I have a TBI. I feel concussed all the time from my TBI, so I would worry that this would make it worse. Yeah, traumatic brain injury. Mm-hmm. Yeah, again, most of the time it doesn't make it worse for those types of cases, but you just always want to have an assessment first, because if you have severe metabolic impairments or you're highly inflamed, that needs to be dealt with first, or you can get more side effects from it. And for someone like yourself, you may not recover well, right? So somebody that doesn't have metabolic impairments, they might feel bad for an hour and then they're okay. But for somebody that takes their body a long time to repair, like same thing with like a good way to tell is if you can exercise and you can tolerate it, you don't feel dead for 2 days. Yeah. Then you're probably not going to have any issues. But if you have a lot of fatigue and stuff, yeah, you do have to be careful that you don't push your brain too hard. However, keeping this in mind, your brain is doing everything. We're not forcing it to do anything. We usually will give it multiple different streams that it can choose from, and it'll choose the most metabolically effective way every time. It's the most efficient, device other than a mitochondria, which kind of make up the brain. Yes. Other than that, it knows exactly what to do, and it won't. It's not like medication, right? When we over medicate we can cause problems because your nervous system's not in control of anything, right? Yeah. So yeah, very, very, very uncommon to have severe side effects, and if you do, they're transient. So perfect. Can it shrink brain tumors? It cannot. And can this therapy help improve short-term memory? Yep. And I'm going to get really repetitive here. It's same thing. It depends what's causing the short-term memory problems, which is why you want an assessment to make sure that you're isolating cause before you start trying therapies, because otherwise you don't know, right? If you just throw 100 people with short-term memory into neurofeedback, you'll get some improvements, but you may be one of those 20 people that doesn't improve because we're not targeting the right cause. Yeah. And just because there was a few more questions, a lot of it just, I think, like you keep saying, you really need an assessment. So if someone wants to
kind of figure out if they can work with you? How do they go about, like, what's the process for that?
Yeah, you know what? I'll put, we have a link on our website that that takes you to a complimentary call with one of our patient care coordinators. So they've been kind of trained to know a lot about everything that we do. They'll kind of talk to you. You can ask them questions. You can share with them what you're dealing with, and then they can let you know if you're a good fit. And then we do have other practitioners. So if, you know, it's something that doesn't seem like a neurofeedback piece, then we could probably at least point you in the right direction, or give you a proper referral. And so that's complimentary. I can throw that in the chat box here. And then if you're like, I absolutely want to book a QEEG, like that's just what I feel like I need. You can just call our office, or you can book a consult at that link I just put through the chat, and then they can give you some more information about that.
Yeah, I will add that link into the email I send out with a recording. Cool. And I think a lot of you were wanting that light, or that webinar. We spoke a lot about light. So I'll just send that as well with the recording.
Perfect.
Tomorrow or the next day. Awesome. Yeah, I think we will wrap it up for this evening. Again, yeah, if you guys have any questions about anything, you can reach out to me or to Nirvana Health Clinic directly. But thank you so much, Corey. Always love learning from you. Now I have so many more questions and things to look up, but
yeah, there's a lot out there. Keep exploring. Is a lot of just amazing things out there nowadays. So it's just taking a lot of time before it'll trickle up into mainstream. So
yes. Oh, just quickly, the course you were talking about, is that for anyone to take, or what exactly?
Yeah, it's gonna be, we're gonna have a few different versions. So we're gonna have a practitioner clinician version. That'll be available to anybody that wants to take it. It's very thorough. It's going to go into testing and, you know, treatment and all of that. What we've found in our database, in, you know, what we've learned through the research and clinical practice. And then we'll have a watered down version of it a little bit. That's a little bit easier to kind of comprehend and follow. It'll be less in depth and, you know, less kind of how to diagnose things and just more overall info about different, you know, problems and how to fix it. So yeah.
Awesome.
Yeah. And so if anyone's interested, you can just send us a message or an email, and we don't have the landing page quite yet. We will soon, because we're going to be publishing the first module right away.
Okay. Awesome.
So yeah, we can send that link out when we have it.
Perfect. Yeah, awesome. So thank you so much. Thank you everyone for tuning in this evening, and definitely look for that email coming to you in the next few days. Hope you guys all have a great rest of your week, and we will see you next time.
Awesome. Thanks for having me, Leanne. Take care.
Thanks, you too. Bye.